blood pressure. Hope you can all hear me and see me. So today's blood pressure presentation will be presented by Catherine King. Catherine is doing a PGCE in adult education and has been with us for the last 5 to 6 weeks, creating this wonderful blood pressure presentation. As you know, high blood pressure is is becoming more of an issue, especially operationally. So this is more of an awareness training presentation. So Kat, if you'd like to take it away.
Thank you.
Oh, there we are.
Yeah, I'm off it now. Okay, so I'm just going to make sure that this is on and this is flicking through. Can you see that screen there? Yeah. Okay, perfect. Yeah, hi everybody. So thank you for coming on. And like Jamie said, yeah, this is part of my PGCE, and I've been working within the health and wellbeing team for a little bit now. So we're just going to get started. So reasons for this presentation today: to identify health risks, prevent development, awareness for all staff, the treatment moving forward, the process for removal from operational duties, and the consequential effects that it's going to have on everybody. So today we're going to cover what is blood pressure, differences between systolic and diastolic, what is high blood pressure, causes, symptoms, preventions and consequences, treatment, awareness information, and the importance of the awareness with high blood pressure for everybody here. So there's a numerous amount of research out there that covers high blood pressure and the severity of what it is and the impact that it has on people. But these are just a little bit of what I found online. So the current data shows that almost 75% of firefighters have hypertension, high blood pressure, and less than 25% have their blood pressure under control. 7 million people in the UK have high blood pressure and don't actually know about it. And approximately 3/4 of the emergency responders have elevated blood pressure. So these are, quite extreme statements that have came out and that have been researched. So it just shows the importance of why what we're doing today is so important. So what is blood pressure? So blood pressure is divided. What is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. So blood pressure can be divided into two parts. There's systolic, which is the top number on a blood pressure reading, and then there's diastolic. So systolic is the top number of the blood pressure reading, and it's the maximum pressure that the heart exerts while beating. This number can change based on situations. So in relation to your job, if a fire alarm goes off, your blood pressure will increase because your heart is beating faster because your heart rate is higher. Diastolic is the bottom number on the blood pressure reading. It is the amount of pressure that is in the arteries between beats. It is the lowest possible pressure within the circulation, and it is less likely to change as much as a systolic number. So at the bottom, there's just an example there. So if everybody's obviously had their blood pressure checked, these are the type of numbers that would come up. So you'd have a high number and sort of a lower bottom number. This is systolic and diastolic. So what is high blood pressure? Well, high blood pressure indicates the circulation is under greater stress. This is when the blood is being pumped by the heart into the arteries, and the blood places additional pressure on the artery walls. So the force of your blood pushing against the walls of your blood vessels is consistently too high. That is high blood pressure overall. Okay, so blood pressure classification. So a healthy blood pressure is anywhere between 140 over 90 or lower. So the average is about 120 over 80. High blood pressure is greater than 140 over 90. And yours for operational duties is 180 over 100, which you can see is significantly higher than high blood pressure in general. So if you were reaching the 180 over 100, it would be a serious cause for concern, as you can see on the graph on the right hand side. The potential consequences of having high blood pressure There's quite a few. Weakened and narrow blood vessels to the kidneys, diabetes, metabolic syndrome, vascular dementia, heart attack or heart failure, stroke, and the highest one would be death. It is very, very serious when you do have high blood pressure. And looking at the numbers for removal of operational duties, 180 over 100 is significantly high. So causes of high blood pressure, being overweight or obese, too much salt, lack of fruit and vegetables in the diet, lack of physical exercise, sedentary lifestyles, drinking too much alcohol and caffeine drinks, Red Bull, Monsters, things like that, smoking, sleep deprivation or disturbed sleep. So the government recommends that you have a minimum of 7 hours sleep for your body to be able to function day to day. Lack of sleep obviously has a huge implication on the body and big knock-on effects to your day-to-day life. Over 65 years of age, family history of high blood pressure. Just stressing on the family history, a lot of people don't know about it. So if you don't know about your family history, it's quite important to go and double check it and find out, because if you have got a family history of high blood pressure, it could have a knock-on effect with you, and you might need to go and get your blood pressure checked as well by your GP. Preventions, physical activity. So the government recommends 150 minutes of physical activity every week. So although this, as a number seems quite big as a whole, if you're spreading it out over 7 days, it's definitely manageable. Healthy, balanced diet, a healthy weight, no smoking, limited alcohol intake or none at all, enough sleep. So looking to get to 7 or 8 hours sleep minimum, and GP checkups. So there are symptoms that run alongside this we've put down sort of silent killers. So although these symptoms aren't just solely focused on high blood pressure, they can be for other reasons as well. These are the ones that sort of can happen and show up. So blurred vision, nosebleeds, shortness of breath, chest pain, dizziness, and headaches. If you do find yourself having some of these symptoms, it would be recommended that you would seek immediate medical attention, and definitely let the health and wellbeing team know about it as well. So what can you do to prevent this from happening, and to monitor yourself and your body to make sure that you're at the best that you can be for your job? So it is recommended by the NHS that if you're aged 80 to 40, every 2 to 5 years, you should get your blood pressure checked, which I think is quite a reasonable amount of time to get it done. Age 40 or over, at least once a year. Lifestyle change, so sort of getting rid of those bad habits, looking to exercise a little bit more regular, making sure that you're monitoring things that you're doing day to day. And medication. So there is lots of medication that is on here that sort of looks quite confusing when you look at it all, but they pretty much do the same thing, which is remove water from the blood. The medication, however, can differ based on medication that you're already on, your age, the severity of the high blood pressure and what might be going on with your body at the time, and your racial background. But these are the medications that most people with high blood pressure could be put onto. I'm going to pass it over to Jamie, who's going to run through the operational procedures for high blood pressure.
Okay, let's just right then. So yeah, when we go out to do health and fitness reviews, or operational firefighters or employees have a 3-yearly periodic medical or yearly medical, then blood pressure is one of those things that is tested. And as we've already explained, that our removal limit is having a blood pressure over 180 over 100. Now that's an even or account. So you could have a normal systolic blood pressure below 180, but still have a highest diastolic over 100, and that would still be a cause for removal. So we just go on to, so if that does happen, then this is the procedure. So we recognize we've tested and assessed the blood pressure. Now we don't give you the employees any sort of diagnosis. We're there just to measure. So we can't give a reasoning, but we will offer, we will do it multiple times, and we will give an opportunity for someone to relax. So if they do have a limit on their blood pressure over 180 over 100, the employee will be asked then to call control and book sick, which goes down as occupational health leave for HR records, so they don't need a sick note. Following that, they will be given a letter from their health, fitness and wellbeing team. The letter is also attached to the appointment for today's presentation, so you can view that. So this letter allows us to write down what their measurements are and take that to visit their GP, so their doctor's surgery, and Kaya Health will also be informed. Once they go to the GP surgery, the GP's responsibility is to investigate the high blood pressure and provide either treatment or a reasoning for having high blood pressure, as we've identified, whether that be test anxiety or whether there be an underlying reason which requires treatment. If they are medicated, then the employee must obtain 3 weekly blood pressure readings, and they need to be under 180 over 100. So already you can sort of see the time frame that this is taking. Somebody has to obtain 3 weekly readings from the GP surgery and have it signed off, but they can use the letter that we give to sign it off. It means the doctor does less work. They can just stamp it and sign it each week. Following this, they've been medicated and they've provided 3 weekly blood pressure readings. This information then gets passed on to Kaya Health, who review the blood pressure readings and will assess whether fit or unfit to return to operational responsibilities. So the next slide, we're going to be talking about who is affected by high blood pressure. Well, we all have a heart, we all have circulation, we all have blood running through our veins, and so everyone can be affected by a high blood pressure. Okay, the causes, the effects, the consequences of high blood pressure, every one of us can be affected by these. The way it gets more challenging for us as a service is to be able to have, if we don't have operational firefighters, then we don't have a service to provide to the general public, to the local community, which is why, an operational employee with high blood pressure is then removed from operational duties. And that's going to have a knock-on effect to both the service and the community. So say it's an on-call station, or it could be a whole-time station where somebody is taken off because of high blood pressure. That puts strain elsewhere in the service. It might cause a station to become unavailable. That means longer waiting times for the local community should there be a call out. However, the other side, the flip side of the coin, is that we're sending somebody out. If we don't remove them, we're then sending somebody out with high blood pressure. And we've already explained that the consequences can be fatal. And it is a silent killer. Not all times are you going to get these warning signs that are the symptoms. So it's important that we prioritize their health, and we take these measurements, and then they go and seek the treatment that they need. So a lot of this presentation was geared to giving you a few more tools about how you can help, because we don't want to be having a battle with you trying to convince you that what we're doing is the right thing. This is the right thing that we have to do in order to put their people's health first. So the first thing you can do to support employees, if they are removed, or if you can see it, if know somebody's had previous issues with their blood pressure, is trust in the process. We've got a process in place, and it's there to develop trust with the person. It's there for us to know that what we're doing is actually right, and everyone is safe, everyone's being referred and seeking the right medical intervention that they need. If the doctor's saying that it's down to test anxiety, then that's fine. We just need a fancy letter from them saying that, okay, it's probably down to test anxiety, but they probably have that investigated with a 24-hour monitoring blood pressure monitor. The second thing we can do is also have discussions with all our employees, and that includes people that we might manage who are non-operational, because stress can manifest itself in many different ways. So, and as we've identified, high blood pressure has serious consequences. But making our operational employees aware of our discussions, these presentations, we'll also have stuff that we can send you, like literature, handouts and things. So you can have those discussions with individual fire stations to make sure that everyone's on board, everyone's on the same page. We're also going to be doing some, the health, fitness, wellbeing team are also going to be performing some analysis. So everyone that's got a blood pressure over 160 over 90, or over 140 over 90 for resting blood pressure will be identified. And if you want those details of those people, that the station that you manage, you support, we can give you that information if you think that if you want to have discussions with those people. It's been recognized you have blood pressure a little bit higher. You should go and get it checked out before, you know, it becomes something serious. Somebody's blood pressure the other day, well, the systolic was fine and the diastolic was 99. What will it be next year? Another year older, the cardiovascular system another year older. So we're doing that analysis in order to help you have those discussions. We're also looking to promote healthy living and maybe do some lifestyle changes. We can assist you with that. So looking at people's exercise, what their food and drink choices are, and you know, it's a lot of this stuff is making simple little changes as opposed to putting people on diets and say that you've got to follow a certain health regime. There's numerous diets out there, but you know, a lot of these don't work, and it's simple life changes that just need to be adapted. But like I say, we can help you with that. Also, encourage self-care. I bet each and every one of you has a way of distracting yourself or taking yourself out of work. You know, it's whether it be on Friday nights and your go-to is going out for a run or practicing mindfulness or meditation or stretching, or simply focusing on hydration and breathing, or even taking yourself into a book, into another world to try and switch off from the workplace. What, you know, think about if you've got children, what would you advise them if you needed to change a subject or think of something else, or, you know, take the focus off work, essentially. Think about those self-care routines that you've got and what you can promote. There's no government guidelines behind that. You know, it's all about taking what you know, your wisdom, and give it to someone else. So again, through those, you can have those through those discussions. We've already mentioned that encouraging regular GP checkups will also assist with preventing, or, you know, being more aware of what someone's blood pressure is. If I was to ask you, what's your blood pressure right now? Not a single one of you would be able to tell me. You might know it's generally low, it's generally okay because you've been and tested, but you wouldn't be able to tell me what it is right now. None of us know until it's been measured. So having those regular checkups are important. You could also invest in a station blood pressure monitor. So we've just invested in 2 brand new monitors for the health, fitness, wellbeing team. These are all stamped with approval from the Hypertensive Society, and they were £29 from Argos. It's not something that's an expensive piece of kit, but it's something you could have on fire stations, or you could have to take to fire stations if you were doing a visit, so people could monitor their own blood pressure. Also, the last thing is that you could also refer anyone to the health, fitness, wellbeing team. We're more than happy to go out to people to help them measure their blood pressure, and it could be any department. I've been in control this week where we've done a little bit of work on this. But if you want us to attend fire stations, or you want us to do a repeat return to someone who's previously had investigations of blood pressure, that's okay too. We'll also be, like I say, we'll be creating some posters and be giving you out some of these British Heart Foundation leaflets that explain all about blood pressure and the consequences and how it can be changed and measured and what the causes are. So that brings us towards the end of the presentation. So if anyone's got any questions, please feel free to raise your hand or to unmute yourselves. I'm just going to stop recording.